All right, so this is the title that was given to me by Matt, although A Hitchhiker's Guide to the Galaxy is one of my favorite books, Douglas Adams, so thank you for thinking of me, buddy. And I'm going to walk you guys through kind of what my journey's been like. I've been a physician for 14 years now. I don't look like it. Everybody calls me Dr. Doogie, but Telescope Health is our company. We started 6 years ago. So we saw our first patient actually in early 2019, but building the company started 2018. And I'm going to start with a story. This is so first of all, this is Dr. Jackson. She's one of my good friends. She's one of our doctors. She's actually now taking over as president of the Florida chapter of emergency physicians. She's super cool. That's a fake patient. That's not a real patient. It's a stock photo. Well, this is our mission statement. So remove barriers to care. I always focus on that. So this company started from the issues that personally myself and my co-founder, we saw in the emergency department. How can we solve some of those? And it started with some naivety, I'll say that, because understanding the problems within this giant sector of the market in healthcare is very complicated, and that's kind of what we discovered, and we've had to pivot several times. But in essence, three pieces that we use there: innovative thinking, human connection, and technology, wrapping those together to help people and improve care. So I'll give you a quick story. A patient came into an ER, and this is something that will resonate with a lot of you guys, I hope, but came in for shortness of breath, tried to call his primary care doctor, couldn't get seen, went into the ER, had a big workup done, because when we have somebody come in, we want to cover our own butts, and that's what we do. So, and rightfully so, did a great workup, had a CAT scan of his chest, everything was normal, no heart attack signs, no pulmonary embolism or blood clot in his lungs. However, he had a nodule on his lungs that looked like lung cancer, and oh, you're fine, out the door you go. By the way, you might have lung cancer. You should go get a biopsy of that. That's what the radiologist said. Don't ask me any more questions. I don't know anything about it. That's what they said to him on their way out. So this person, understandably, very concerned, very well-connected person in the community here locally, called MD Anderson, got an appointment for a biopsy in 3 months. So you can imagine you're waiting 3 months for that to be done to rule out cancer. So during that time period, who knows what's going on? So called us the next day before, right after leaving the ER. Our team of care navigators advocated for this person, got him an appointment later that week, had a biopsy, it was negative. He went on to living his life, okay? So healthcare is very complicated, and the road to finding care is fraught with all sorts of barriers and problems. This is my co-founder. So we were originally a pet project of our parent company, which is an ER staffing company. Locally here, if you've been to a Baptist ER or Flagler or Lakeland or Southeast Georgia, fully physician-owned staffing company, you've seen one of our docs. We started it saying, okay, we're going to be a niche concierge telemedicine service. We're going to help our health system partners. This will be a pet project, and then we quickly spun the company off to a separate entity, and that was Telescope Health, and grew. And we went from local Jacksonville direct-to-consumer product to a national company that serves value-based organizations, health systems, payers, and largely employers now. So at our core, 24/7 care navigation and physicians, and then analytics, and we have a deep analytics platform background now that kind of guides everything. So how do we get there? So this is actually, I actually had a lot longer hair back in the day, and this was me in my living room taking a picture of our initial platform, which was a third-party platform that we didn't build, and this is the logo that I created using Canva. So got to start somewhere, right? And this is a picture of me and my wife and our now 7-year-old daughter as we're walking to the beach, and this was the motto that I came up with, late night, one night. So how do we get from there? I was thinking, okay, I want to create a telemedicine company. I think emergency doctors, we've got a pool of emergency doctors. We can grow this and create some change. I knew nothing about the industry, really. And so we grew that to, and this is actually me next to Kristen. I just love Kristen, but we provide free care for Rethreaded. But we embedded ourselves in partnerships with large benefit administrators throughout the country, large healthcare organizations, value-based organizations, insurance companies, universities, municipalities. And how do we do it? Certainly wasn't me alone, and so I'll kind of walk you through some lessons that I learned along the way. So lesson number 1, don't kill the puffy guy. Okay, this is chapter number 1 of my book. I get everybody's attention here a little bit, so we're going to talk about blood and guts today because I'm a doctor. Does anybody know what this is in the bottom right-hand corner? This is what makes an ER doctor have to change his pants when this walks in the door. Anybody? Okay, yes, so more specifically, it's angioedema, which is swelling that can happen from anaphylaxis. You're very right. It can also happen from medications, and the one that's really scary is when it happens from a medication it's very hard to control, so specifically blood pressure medication. So, 15 years ago, I'm a young ER doctor, and this guy walks into the ER, and I'm going to show my chops. I'm going to take care of him, and the way we do that is we have to manage the airway very carefully, start giving him medications, but you want to secure the airway, and this can progress within an hour to something where there's no room for him to breathe whatsoever, so you have to act very quickly. And so I decided I'm going to manage this myself. I know how to do this. I'm a trained ER doctor, and I struggled a lot. And I'm in St. Augustine. I'm at Flagler Hospital, and there was a part of me that said, do not call for help. Specifically, do not call an anesthesiologist for help because your ex-girlfriend's an anesthesiologist, and you're going to tell her that you can manage this all by yourself, okay? So she wasn't the anesthesiologist, I can't help. And don't call the hospitalist or the ICU physician because they think you're not capable either. So eventually I said, this guy's going to die if I don't do anything. And so called down the intensivist. He couldn't get the airway either, so we're trying to intubate this patient, which means putting a tube down his throat, past his tongue. We're using fiber optic scopes. The anesthesiologist drives in from Ponte Vedra, and all three of us together are realizing very problematically this guy's going to die. So thankfully it didn't, and this is AI, so I got a lot of AI images here, but I typed in for this, 3 frightened doctors taking care of an ill patient in space. So that's what happens from artificial intelligence when you put that in. And then I typed, make them more frightened. And so if you want to replicate that image, that's how I did it. So cliff notes for this chapter, and take that lesson and apply it to our future growth. And if I go back to the slide here, the most fruitful partners that we've had are partners. They're not clients, they're not people that we're giving a service to that's transactional. It is an ecosystem that we're building where they are providing us with a service, we are providing them with a service, and we are authentically, strategically working together to grow an ecosystem. And so the reality is, at least in my industry, the clients that you have are very seldomly can you alone with your services provide them what they really need to make meaningful outcome and change. And so you either have to adapt, grow, and deepen your capabilities, or you have to partner with somebody who can quickly provide that service to allow you to scale and grow. And to do that, you got to let go of your pride. You have to realize you can't do this alone. And you got to find like-minded partners and trust your gut. We've had some partnerships that have been one-sided, and you learn along the way. But collaboration itself exponentially expands your opportunity. So that's been a huge lesson for us. And they actually study collaboration, and this is in public health, where we do a lot of public health initiatives with Telescope Health, trying to create meaningful outcome change for large populations of people. And collaboration is very important to that, but you got to have effective communication, strong leadership. You have to have trust and concrete and focused goals. So this is a very difficult thing to learn, and it takes direct intention. So I'll say it's been a huge lesson for us as we've grown to be open with your communication with your collaborative partners. And that'll lead me to the next chapter, the cocky fool. So this is chapter number 2. This is one of my favorite curves of all time. If you guys have never seen it, the Dunning-Kruger effect. Has anybody seen this before? Yeah, it's great, isn't it? Okay, so when you start to learn something about a topic, you realize, I know everything about this topic. I'm a professional. And that's kind of, if you look back at the evolution of our company, I said, I'm an ER doctor. I know exactly what people need. I know exactly how to make a meaningful outcome change in this industry or market. And all we got to do is slap it onto virtual care and we're good to go. And you realize very quickly, once you gain a certain amount of experience, that I don't know anything. And so where do you want to live on this curve? And I would argue that you never fully actualize to the far right, because no industry is static, and there is always evolution and change. And so Where I like to try to strive to live is just right on the upslope, because there's always something more and more to learn. And the minute you become too confident or think you've got it figured out, there's change in the industry. So again, this is from a slide I just pulled deep into our archives, but this is early 2019. I thought, okay, we're a physician-led healthcare solution organization. It's enough that we're physician-led. That should be enough to really sell this concept to people. And the reality is no. And here's two perfect examples of this. The Consolidated Appropriations Act, does anybody know what that is? It's a 2,000-page document that was brought into legislation in 2022 and has huge impacts on employers. It states that employers are responsible for providing the most cost-effective healthcare solutions for their employees. They have the fiduciary responsibility for this. And in fact, the employees can sue their employers if they are receiving no advice on their healthcare plan or are not directed to less costly healthcare solutions than they should have been able to receive. So this is happening to Johnson & Johnson right now, actually, because their health plan had a $10,000 drug on it that you could buy for self-pay cash for $170. So healthcare is broken. Employers are now on the hook. So we had to understand how we provide solutions that help employers in the lens of this 2,000-page document. The second piece is value-based care model. Here in Florida, and mostly just about everywhere on the southeast, you go into the ER, you go to get health care, the providers, the system, the health system are paid for that transaction. It's called fee-for-service. The movement over the past 20 years has been to change this to, well, why aren't we paying people for the outcome? Why are we paying them to say, hey, just keep using the same thing that's doing no change, but you're coming back, so we're going to get paid and paid and paid. So who wins here? Well, whoever's contracted with the insurance companies to receive a great amount of money for their services. So as an ER doctor, if somebody came in to see me, I don't give them any great advice, and they come back the next day, I get paid the same for both of those encounters. So as a country, we're shifting away slowly. The economic models for health systems and organizations is shifting towards, hey, we need to follow your population over time, and we need to see if those diabetics that you're supposed to be taking care of are actually controlling their diabetes. Are they using the ER appropriately? So those two concepts are great examples of, well, these are highly complex things that drastically impact delivery of healthcare. And I've spent the last 5 years realizing how much I had to learn about this, and not only learn about it, but bring people onto our team that had expertise in these areas and could teach not only me, but our company, and create value and drive growth. So for us, scalability was, well, gosh, we need multiple verticals here. This is an example of our analytics. Every single one of these little factors here is a data point on quality outcomes and patient population for an organization. So anything from, you've got 1,000 patients that need their blood pressure controlled. How well are we doing this? Each one of these pieces tells a story. I didn't build this. I didn't know how to do this. I'm a doctor. I'm a rehabilitated doctor, but I'm a dumb doctor, okay? So I think the key is we brought on people who had vast, deep expertise and knowledge in healthcare analytics and understanding the business model of value-based care. And I've learned a lot from that and grown from that, and our opportunities have grown from that too. So now, when we started as a physician-led telehealth company, now, and this is Cheryl, she's one of our care navigators. If you called our number right now, you'd talk to Cheryl or one of her other care navigators. But you can see how we've grown to all these different services, and they feed off of each other and help each other grow and create a more complete product. And a year from now, this may expand as well. Now, you can't expand, at least in our model, can't do everything, right? And we've had strategic partnerships, but all of these pieces we find are the things that are vitally important for us to go into a partner and say, here's how we can reach out to your employee, your patient, and create meaningful change for them. So I'll say this, does anybody know who this guy is? Rick Rubin, The Creative Way. So this is one of the founders of Def Jam Records. So if you like Johnny Cash, if you like the Beastie Boys, if you like Jay-Z, this guy's behind all that music. He's not a musician, he's a very fascinating guy, but he recognized greatness and he's one of the most famous music producers in the world. I love this quote from him: "The urge for perfection is overwhelming. It's too much. We are frozen. Sometimes end up convincing ourselves that discarding the entire work is the only way to move forward." So I think, and then this is my AI picture here. Show me a picture of building the plane while you're flying it. Make it less cartoony, make it dramatic. That was what I typed in, okay? And that's what came out of it. So go have fun with Copilot and ChatGPT and, experiment. But that's my picture for you. I'll give you another example. COVID hit in March of 2020. Before that, we were seeing about 15 patients a day on Telescope Health, and it was all direct-to-consumer advertising, and we were on our way to working out a white labeling deal with Baptist to be their telehealth provider, which we are now. If you use Baptist, virtual care with Baptist, that's us behind that. But then COVID hit, and the ERs were flooded with people, and we realized, gosh, these people are all coming in for a COVID test. We need to start a COVID test site. At that time, you had to have an order and see a physician, so we needed to leverage Telescope Health to see people. And we had a week to do it. So we went to the city, and I will say this. We had no idea the complicated things that were going to come out of creating a test site, creating contracts with Quest and LabCorp, facilitating with the city, with the Department of Transportation, getting Prime Osborne ready to go to have infected people coming through it, working with JSO, so many aspects, but we just said, we can do this, and we're going to do it. And I think not knowing those things was honestly a benefit a little bit. And that's, having that optimism and just saying, we can make this happen, I think is great, because the alternative is you're an armchair pilot, and you're sitting and watching other people take the opportunity. So there is a sweet spot where you have enough capabilities where you should go after an opportunity, and you learn so much from doing that, and that's what we found. And over the course of the pandemic, we saw virtually and treated with COVID tests over 45,000 people in Duval County alone. And that changed our company, changed our opportunities, and it's all because we said within the course of a week, I don't think I slept that whole week, we're going to build this and make it happen. And I think that kind of leads into my last picture. So this one is, show me a ancient times leader who leads with optimism and happiness. That's my picture. So I own all these pictures, by the way, now, so don't even try to steal them. Okay, so for us, the last digital healthcare, I don't know if there's any other healthcare speakers coming to this, but 98% of digital healthcare startups fail. We are in our 6th year. We've bootstrapped ourselves. We're very fortunate. There is a lot of money and a lot of opportunity behind a lot of companies that we have worked with in the past that are now gone, that we've seen that are now gone. And what's the difference? I mean, they had more money than us. They had more opportunity. And I think it just really honestly comes back to, at least for us, culture. And culture is encompassing for a lot of things, but authenticity. So this started from a place where we had a deep understanding of a certain aspect of the market. There were areas that we did not understand, and we realized we had to grow through partnerships and collaboration and understanding and lifelong and learning. And that's where the humility comes into play. And we've had some failures. We've had to have some resilience. But again, optimism is one of our core values. And so I would say, you don't get success without failure and resilience, at least not in our industry, and that's been a huge driver for us. All right, thanks, guys. Sorry. Thanks.